Is there any non-surgical procedure, such as radiofrequency, ultrasound, laser, that can restore volume around the lips without fillers? I am 58. I have lost volume around my mouth, resulting in small wrinkles and puckering. My skin is not sagging in my lower face. I had a facelift in 2010. I want to avoid any kind of filler or injectable, so as to avoid the complications of embolism or tissue necrosis. Is there any device that is best at restoring lower facial volume by increasing collagen and elastin? If so, how often will the treatment need to be repeated to maintain the result?
Thank you for your question. You've submitted a question without a photo, but you're asking, is there a non-surgical laser or radiofrequency treatment that can restore volume around the lips without fillers? And you express a concern about potential for necrosis and embolism. Well, certainly I can give you guidance as to how I counsel my patients with similar concerns when they come for consultation. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and I certainly have witnessed a remarkable evolution of technologies and development of products to help people look their best. You also mentioned in your question that you had a facelift in 2010, so it's not necessarily about sagging, but it's essentially to restore these areas. Well, to begin with, I can give you a little bit of perspective again about the benefits of non-surgical treatment, but also understanding the relative risks of necrosis and embolism. These are situations which are absolutely terrible and occur very rarely. And I can give you some ideas as to how we can avoid these things, because essentially, when you're 58 years old, and although I don't see a photo, I can say that a lot of our patients, when they come for a treatment, they want to see results. They want to see something that's not subtle. And the challenge with radiofrequency devices or non-ablative devices is you are basically treating the skin, which is barely 2 millimeters in thickness. And the reason why you're dealing with issues, whether it's wrinkles or volume loss, is mostly due to bone loss. You see, unfortunately, as we get older, we lose bone volume. And above that, we lose fat, soft tissue, and essentially, there are many layers that are several millimeters thick and many milliliters in terms of volume loss. So one of the unfortunate challenges for patients is that lasers and radio frequency technologies can be very effective, but they only play one part in the role of helping people restore volume. So I can tell you that in my practice, I have certainly developed a lot of methods and techniques to minimize the potential for these problems such as embolization. No doctor wants to ever experience that, and certainly they don't want to have a patient experience that. So what we do, I'll give you an example. There's a method that we do called structural volumizing. And with structural volumizing, what I'm using is essentially cannulas. Cannulas are special instruments that are placed that are blunt, which makes them unlikely to actually pierce a vessel. The problem with embolization and ultimately necrosis is that the material that's being injected ends up going inside a vessel inadvertently, and that's because when you are using a needle, depending on the technique and the placement, there's a possibility you can pierce a vessel. Well, we know this from liposuction, because with liposuction, the cannulas actually roll past vessels and you get minimal bleeding during liposuction by the same concept. And so when you use cannulas in placement, you also are less likely. It's not impossible, but it's less likely. I think that it would be worthwhile to actually talk to doctors that you meet with and understand really what the outcome will be. You're asking, is it possible? Of course, it is possible. We have technologies in our practice using lasers and radiofrequency to help improve skin quality and to do some tightening and to stimulate some collagen. We can actually do it using various lasers, but the limitations are how much collagen, how much soft tissue can you generate, and can you do the same as fillers? Overwhelmingly, I would say from my experience, you can't even come close. Fillers really can be very effective, and you often need a fair volume to actually achieve really significant results. And that volume has to restore structure. So I think that you shouldn't necessarily just close your mind to the use of fillers. Speak to doctors, learn about the techniques that are employed. There is a lot of finesse, a lot of art to doing this, and certainly the instruments that we have available make this a less risky procedure. We do a lot of injectables in our practice, and I am constantly improving people's cheeks, jaw lines, lips, the folds around the mouth, the marionette lines, the nasolabial folds. I mean, this is something we do all day, every day. And it really is a pleasure to employ more advanced techniques that use these types of instruments such as cannulas to minimize the risk, not only the risk of embolization, but minimizing bruising and allowing people to quickly recover so they don't have much bruising and swelling and are able to get back to normal life as quickly as possible. So it's important to understand what the limitations are of these new or modern thermal energy devices and understand what kind of outcome will be satisfactory to you before you move forward. Unfortunately, a lot of people are very disappointed with the results of thermal energy devices because their expectations and the way it was presented to them were ultimately the presentation did not match the results, and therefore people get disappointed. So realistically speaking, I think there is probably a role for fillers even without looking at a photo, and just understand that there are different ways to place these fillers and different ways to actually create these results, and you want to do is minimize the risks. So I hope that was helpful. I wish you the best of luck. Thank you for your question.